So the countdown to 2020 is on. We're just a few days away from a new decade, and with it, some new life-changing wellness practices are already trending. So before we jump on the New Year Me bandwagon, it's time to throw a handful of trends from 2019 before we scream Happy New Year.
And joining us now is Dr. Tiffany Caplan, a nutrition expert and the co-founder of the Caplan Health Institute. So you're going to break down some of these trends that we should leave behind. And you also have some tips for a hangover cure, which I'm sure is going to come in handy for a lot of people. So let's start with the trends from 2019 that you're just saying, bye-bye, let's leave them there.
Yeah, there's been a lot of trends in this last decade that I think we can just learn from and move on. I got asked a lot about celery juice. That was huge for a while. We couldn't find celery anywhere in the stores. It was like the miracle cure-all. And really, unfortunately, the basis behind all those health claims don't have any research to back them up. So I would say celery is a good food in general. Add it to your diet, but I wouldn't be going and juicing it by itself. I would eat the whole food, so you get all that fiber. The carnivore diet, that was also huge this year. People were ditching the fruits and vegetables altogether and just eating animal proteins. And that was another miracle cure-all. But if we could just learn anything from these extreme diet trends, is that they're not going to just fix everything. They may be a good reset, they can be helpful, but we want to make sure we're eating a real well-rounded diet and looking at personalized nutrition. And then the other thing would be looking at stress management is a huge thing that we want to work on in the new decade.
This is stuff we want to bring in.
Oh,
yeah.
yes.
Okay.
We want to leave celery juice out.
We want to leave the celery juice and the carnivore diet. Plant-based alternatives is also something actually we want to try to leave behind or maybe make some changes with. We want to make sure that we're understanding that these things are not as healthy as we want, like the Impossible Burger actually has just as many calories and more sodium than an actual Whopper, and has the glyphosate from Roundup. So we want to just be educated on our dietary habits and what we're actually consuming. So
wow,
those would be things to avoid.
I did not know that. So benefits of some new 2020 trends.
Yes, so like I was saying, stress management is actually huge to try to incorporate. We're seeing that doctors are actually prescribing nature. It's telling patients to put down their devices, get outside. Stress is related to so many of the chronic health conditions that people suffer from. So if we could just change some of those habits, maybe do some meditation, which isn't new, it's been around forever. That's really great and it can be beneficial. Also CBD has been everywhere, and actually we do find really good benefits. People using it for pain, for sleep, for anxiety, but it's not everything. There's a lot of other extracts that they're now looking into too from the same plant, CBN, CBG. So I think CBD and on that whole plant is going to be really in the focus too in this next year.
What about oat milk? Is oat milk okay?
Oat milk should be okay,
it
yes.
tastes so good.
Yeah,
I just hope
creamy.
it's not a problem. Yeah.
Yeah, no, most people are fine with oat milk and those other alternatives. You just want to make sure that all the other ingredients, all the added sugar and preservatives, like if you can find minimal ingredients, that's the best. And virtual health practices too. I find that a lot of people are kind of sick and tired of being sick and tired, not getting answers in their standard doctor's offices, and they're looking for things outside. And a lot of people don't have access to those locally, so they're going online and they're looking for people. So we see patients across the world in our practice that we can help from their own couch in their living room. Right. They don't have to travel and wait in a waiting room. So it's really convenient and it's giving people access to things they didn't have before.
All right. We know folks are sticking around for one thing. Give us a hangover cure. What's a hangover cure?
Yes.
Besides not drinking, because that's not going to happen.
Well, and prevention. Prevention is definitely key. Staying hydrated, making sure you're eating enough during your drinking. I love coconut water for electrolytes. You can also take activated charcoal. Activated charcoal is great to help kind of soak up some of the toxins. And
so you take that before or after you're hungover?
You actually take it after drinking, before you go to bed, but you can also take it the next morning if you're feeling a little upset stomach or something. That can help kind of soak that up and get you feeling better. Even some light ginger tea, maybe a vitamin IV, definitely hydration and food. So skip the coffee and eat breakfast.
All right. Charcoal.
Just don't mix, right? I think that's where folks getting a lot.
If you start drinking hard liquor, you have to keep drinking.
You just have to stay with it.
Actually, just stick with the clearer the liquid, the better. So the darker liquids are going to have other chemicals in there that make you more likely to get a hangover. So stick with the clearer drinks and avoid all the added sugars in the mixers.
That was Jim Morrison's advice. Don't drink anything you can't see through.
There you go.
Well, for more information, you can head to Dr. Caplan's website, CaplanHealthInstitute.com. And of course, You can follow her on social media. Thanks so much for those great tips.
Thank you for having me.